Hi. Many times most of our patients think that hair transplant is once in a lifetime procedure. It can be done only once. But it is not true, and in many cases we need a second or a third hair transplant also. What are these situations? So number one, when a patient has a very big area to cover, grade 5 or grade 6, we cover the scalp over 2 or 3 sessions. So more than one transplant. Second, you get a transplant done in the frontal area. You are at grade 3, you do a transplant on the front, but do not take hair loss treatment. After 5-6 years, your back portion, the non-transplanted area gets bald, so then you will need a second transplant. Third, your first transplant failed or it did not give the desired effect, so a second transplant may be needed to fill this area for a better density or a better hairline. So these are the three scenarios where a second or a third hair transplant may be needed. One, when a very big area is to be covered. Two, when a new area gets bald. And three, when the first transplant didn't turn out to be very well. Now, what is the duration between two transplants? So in the first scenario where we pre-planned the second procedure, the minimum gap should be 6 months and no upper limit. When a new area is getting bald, usually it is 4 to 5 years after your first transplant. When you are contemplating a transplant on the same area, means you are not happy with the results, etc., then the gap between two transplants should be minimum 12 months, because the results of your transplants take up to 12 months to show properly. Thus, we should wait for at least 1 year before we do a transplant on the same area. Some tips for your second transplant: of course, choose your clinic very wisely. Particularly if your first transplant failed, then you should give a proper research, proper thought when you choose your second clinic. Third, make use of beard and body hair, because usually in first transplant, a lot of scalp hair have already been taken out. So be open to take non-scalp donor. Beard, body, chest, back, these are good donor areas in many patients. Third, do not go for a very high density when you are doing a second transplant, because you want to conserve the aesthetics of your donor area as well, and you must understand that after the first transplant the skin is not normal, it is semi-scarred. So do not go for a very high density in your second transplant.